These two things which I am holding in my hand is an abdominal brace or abdominal binder. What is abdominal binder? Why abdominal binders are used? Do abdominal binders have any effect? Especially after cesarean section and hysterectomies. What are the effect of abdominal binder on pain, mobility? What is the effect of abdominal binder on surgical site infection? We will discuss all in today's videos. Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. Cesarean section is one of the most commonest surgery done throughout the world. Approximately 30 million or 3 crore cesarean sections done every year. Post-cesarean section pain is very common, and because of that pain there is immobilization, and because of that fear of pain the maternal bonding with the baby develops with a little bit difficulty. There is anxiety, there is stress, there is difficult bonding with the baby, which ultimately leads to insomnia and difficult breastfeeding. So pain management is a multifaceted approach which requires not only the use of good proper analgesics but also the use of non-pharmacological, non-invasive manages and non-invasive approaches, and that is where the role of a abdominal binder comes. In our experience of last many years, abdominal binder has been found to increase the mobility, to decrease the perception of pain and a better recovery to most of the patients of abdominal surgery. So what are these abdominal binders? Abdominal binder is nothing but a wide compression belt which covers the stitch line, which covers the line of incision. It is said to improve the pulmonary function. It is also said to improve the core muscle strength, and in post-delivery patients it is also said to improve or to put back the uterus into their positions. If in Hindi we talk it about to put पेट अंदर चला जाता है, that's what the patient says. So first of all, before discussing about the benefits, let us discuss about the risk of an abdominal binder. Does this abdominal binder have any risk? In an ideal world, in my experience since last 10-12 years which I have been using, there is no risk. This abdominal binder is made up of such of a material that if you put it on directly on the skin, especially in the summer months, because of the perspiration there may be itching and some kind of a skin allergic reaction. If the skin is allergic to the material the binder is made up of, that is why we advise the patients to wear binder over the cloths which they are wearing. Do not wear directly on the skin. Some people say that this abdominal binder increases the intra-abdominal pressure, and this intra-abdominal pressure may increase the risk of a deep venous thrombosis. Theoretical risk is there, but that risk is mitigated by the increase in mobility, which decreases the effect of immobilization, and that is why the risk of thromboembolism decreases. So we will discuss one by one the effects of this abdominal binder with evidence-based recommendations. This abdominal binder were worn after any surgery in my branch, cesarean section and hysterectomy, has got wonderful effects on the pain and mobility. Now you must be wondering, how does an abdominal binder might have an effect on mobility and pain? See, the basic surgical principle of a pain management of any injury, and by the way, wound, surgical incision is also an iatrogenic wound. So basic principle of a pain management after any wound is immobilization of that particular part, and that immobilization, it limits the tissue tension, it reduces the stress on the tissue and limits the excessive mobility. Because of that the healing occurs and the pain perception is less. So why can't this pain principle of immobilization applied in an abdominal surgery? And that is where the role of abdominal binder comes. Many people have done research, Shipets et al. And Dogger et al. They have researched and they have found out that post-operative day 1 and 4, the pain of a patient after using abdominal binder is comparatively less to the people who were not using abdominal binder. There have been approximately 27 meta-analysis of 27 random control trial in which about 2,741 patients were studied, and they found that this abdominal binder increases the walking distance of a patient, and this had a excellent evidential certainty. It also decreased the incidence of surgical site infection and post-operative pain, which had a moderate evidential certainty. ERAS protocol, which I normally follow at my hospital, is an enhanced recovery after surgery, and they studied the use of abdominal binder, which 3 questionnaires. One is a 6 MWT, that is a 6-minute walk test. Patients who used abdominal binder after surgery, they passed this test with flying colors. They also walked a relatively more distance of 100 meters on post-operative day 1 compared to the 80 meters of the people who did not use binders. Even on a visual analog scale, that is a pain scale, they fared better, the people who use binder, and on a symptom distress scale. Symptom distress scale is basically a scale which has about 14 symptoms like nausea, vomiting, anorexia, pain, fever, difficulty breathing, coughing. changes in concentration, body temperature, and all those. This is called as an SDS. Even the pain was measured using SFMPQ, that is short form McGill Pain Questionnaire. On all those parameters, the people who used binder, that is the AB group, fared a lot better than the people who didn't use an abdominal binder. This abdominal binder basically generalizes the pain over entire abdomen rather than only the suture line, and that's where an patient perceives less pain while moving, while sitting, while standing, while passing stool, and while walking, and that is where the perception of less pain comes. There is a physics which comes along, the effect of binder on the suture line forces. Now, this is not a cement work which we do. We take the stitches and let those stitches heal, and the healing of stitches takes about 4 to 6 weeks, especially the rectus sectus sheath, which is most important layer of an abdominal wall closure. When we take the stitches during the post-operative time, there is a buttonhole mechanism. That means between the stitches there is a gap, and through which the contents can protrude because of increase in intra-abdominal pressure when we do cough, when we vomit, or whenever we go to stool, pass the stool, or if we have a chronic constipation. And because of that, there is something which protrudes out, that is called as a Swiss cheese mechanism defect. So because of this buttonhole mechanism, a gap between the two stitches, and as a result of that gap, the protrusion of a Swiss cheese defect, it leads, there is a possibility of an incisional hernia or a weakening of the stitch line later on. This binder, which we also call as an external stabilizer, post-operative, after any surgery, there are many distractive forces at play. Breathing is a one distractive force, coughing is another distractive force, passing of a stool is another distractive force that constantly keeps on moving the abdominal wall. And if we use this external stabilizer, the force over the suture line is maintained, and as a result, the Swiss cheese defect because of a buttonhole mechanism is prevented, and it helps in healing the abdominal wall wound. Also, one another point is very, very important, that this binder helps in maintaining the waist circumference. Anybody who has done an abdominal surgery, a surgeon, a gynecologist, would know that post-surgery there is a paralytic ileus, there is a bowel distension, and especially in multipara patients, there is divarication of recti, and as a result, the muscles become lax, the abdominal circumference becomes increased slightly. Because as I mentioned in my previous paragraph, the healing of a suture line has to be in a immobilized thing. It takes time. So if the abdominal circumference is more, the waist circumference is increased, the healing would not occur. And what this binder does, it will have a maintenance effect on the waist circumference, and there would be no abdominal distension, and as a result, the healing would occur better. Also, this binder has an effect on the muscle lengthening. The more the muscles are stretched, the more they are lengthened, the less their activity is. And this binder, it maintains the muscles to their normal length, and as a result, the recovery, the healing of the most important abdominal wall layer, that is a rectus sheath, occurs slightly easily. Like I mentioned, there is a moderate evidential certainty that the use of this binder prevents the surgical site infection. Many people have this worry that mere taake pak jayenge, my wounds would get infected, there would be pus from my wound. The use of this binder definitely reduces the incidence of surgical site infection, although there are other factors associated with the use of surgical site infection, the techniques, the patient conditions. The patient is diabetic, obese, multiple surgeries, all those, the asepsis, the hemostasis, all those factors, they definitely play a part. But post-operative, the use of binder is a definite non-invasive, non-pharmacological measure which decreases the incidence of surgical site infection. Another point is, many times there is a discharge from the wound, and mostly it is a serous discharge, watery discharge, which we in our medical language called as a seroma. Sera means water, oma means collection. So collection of a watery fluid inside the wound is called as a seroma. This abdominal binder, what it does is, because it compresses the abdominal wall, there is a minimalization or a eradication of a dead space, and because of that dead space eradication, the collection of fluid inside the abdominal wall decreases. Although the effect of a binder on seroma is least studied, but we as surgeons, especially those who are using, they are very confident that this binder, it minimizes the use of seroma formation. What I do whenever I do a cesarean section or a hysterectomy, I put a good 1-inch gauze piece over my wound, and immediately post surgery I put a binder. Now whenever I am after the closure of my wound, there is bound to be some collection, some blood in the wound. The moment I am putting a binder, that collection, that seroma would ooze out of the wound and would get collected in the gauze piece, and that is why, because there is a no dead space collection, the collection of secretion inside the wound would be minimized, and the wound infection chances would decrease. As a result, I would get a good healed wound after 5, 7, 10 days. Because this binder is causing immobilization, some people say that like in orthopedics, if we immobilize a muscle or a joint for about 4 to 6 weeks, there would be atrophy of muscle. So many people feared initially that the use of abdominal binder may lead to the atrophy of the abdominal muscles, and that would cause problems in future. While that fear has a good scientific logic, but it is not actually true. Abdominal binder basically does not lead to the muscles atrophy of external internal oblique. On the contrary, if that was the case, people would not have been able to sit, stand or lie down with the use of binders. Because we are constantly breathing and there is an abdominal portion of breathing also, so the muscles are constantly moving, they are not totally immobilized. And that is why the muscles, instead of getting atrophied, there is a better core strength after the using of a abdominal binder. So especially the hard binders, the ones which are used for the spinal support, they lead to the strengthening of the muscles. Hernia is one thing which we as surgeons are very much fearful about, because though it is not an acute complication, it may occur after 6 months, 8 months, 12 months, 13 months. It is basically whenever we are closing the rectus sheath, if there is a defective closure of the rectus sheath or if there is a weakness in the rectus sheath, that is where incisional hernia may occur. The bowel contents may protrude out through the weakness of that place. European Hernia Society has issued guidelines in which they have stated that abdominal binder has a minor, modest, but a definite role in the prevention of hernia. Even the IRAS protocols, they made a committee which is called as an Abdominal Core Hernia Quality Collaborative, that is ACHQC quality. This committee submitted an evidence-based recommendations which said that abdominal binder, they constitute a low-risk, cost-effective intervention to improve the pain and mobility in the patients after surgery, and which helps in prevention of recurrence of hernia and occurrence of hernia also. Incisional hernia is a thing, there are many risk factors involved. Patient is obese, patient is of elder age, there is anemia, there is a poor nourishment, malnourished patient, multiple previous surgeries are there, vertical scar is there, patient is taking steroids in any form, patient is a diabetic, patient is having lung, kidney or liver disease, or an emergency surgery or a septic surgery. These all are the factors which lead to increase the risk of incisional hernia in future. The incisional hernia also depends upon the type of incision taken. If you are taking a vertical incision, the chances of an incisional hernia are from 3 to 30%, that are very high. 1 in 3 patients is likely to have incisional hernia in future. But if the incision is a transverse, a fenestal incision, then the chances are only 0.5 to 5%. That is very, very less. So for us, the default incision for any abdominal surgery has to be a transverse incision only, because A, it heals better, there are less chances of evisceration or the burst abdomen, and the chances of incisional hernia are minimal in future. So abdominal binder after any abdominal surgery, in my branch hysterectomy or cesarean section, it improves the blood supply to the muscle. It helps in the healing of the rectus sheath, thereby prevents the future hernia formation. It makes the mobility and the physical activity more comfortable. Immediately after surgery, the overall pain decreases, and it does it by decreasing the swelling and improving the blood circulation. It keeps the abdominal muscle together. It prevents the abdominal distension, the low tone of the abdominal muscles after surgery. I've discussed the advantages of abdominal binder. What are the types of abdominal binder? There are mainly 2 types. One is hard and one is soft. High elasticity, soft binder, which is usually fastened by the Velcro. This is a type of a modified soft version of a binder. There is a Velcro and it is a soft elastic component, but it is slightly made tough by these braces. Normally what we advise is the hard portion has to come at the top and the Velcro portion has to come at the back. This abdominal binder should be worn neither too tight nor too loose. It should be snugly fit, and the golden rule is patient should be able to breathe without difficulty. The problem with soft binders is that if this is not very soft, but if it is a very soft binder, they may curl with all the movements, and the intended use of the binder, that is the coverage of the scar and the distribution of the force to generalize abdomen, may not take place. And that is where the modified hard version comes, which normally I prefer to use. There is another type of a binder which is used, which is a hard orthotic binder, which is used for the spinal surgeries. And despite they are the best type of binders which are to be used. Despite their stiffness, they improve the mobility. Although in our gynec surgeries, we do not prefer those hard binders, we prefer a modified hard version of elastic binders. They are available in different sizes, from X small to X triple X large, from 70 centimeter to 150 centimeter. Although at what size the binder should be measured, the decision varies. Normally it is measured by the abdominal circumference. This abdominal circumference is usually taken at the midpoint of umbilicus at the resting respiration. Not at a peak inspiration, not at a peak expiration, at a resting respiration. But there are controversies because hernia, if the patient is standing and if the patient is using binder for prevention of or an aggravation of hernia, at what point to take the abdominal circumference? Because if the patient is standing, there would be more diameter, while the patient is lying down, the hernia would go inside and there would be less diameter. So the controversy is there, but normally we use binders post-operatively after the surgeries, and in an ideal world, the patient should wake up from anesthesia after using binder. That is not what exactly I am using at my place. I usually put the binder second day after the removing of the catheter and when I am making the patient walk. These binders, they should not be washed. They should be spot and air dried. Spot cleaned and air dried. It should be kept dry and clean. Once the use is not there, you should be putting it out in sun and let it dry. The current practice is, because there is a lack of a scientific evidence, the definite guidelines have not been framed regarding the use of binders. But there is an excellent and a positive feedback from the patients, and there is a better compliance on the part of the patients after using binder, and that is why, in spite of not good guidelines, not proper guidelines, the use is approximately 93%. The correct and a proper use of an abdominal binder definitely helps in recovery after every surgery. Despite the widespread use, the various societies have not been able to endorse them because various studies have not applied the GREAT framework. What is this GREAT framework? It is grading of recommendation, assessment, development, and evaluation to assess the certainty of evidence. These needs to be studied in a proper controlled trial environment. We also do not know whether the abdominal binders, they need to be worn for 24 hours or 48 hours, 1 week, 10 days, 6 weeks, whether they should be worn day in, day out, which activities they should not be worn. But what I personally tell my patient that because first 7 days after surgery, we do not advise bath to the surgery, we advise sponging. We only advise to remove binder while they are sponging and the rest to wear the binder 24 hours, even if they are going to pass the stool. We advise it to be worn day and night. We advise it to be worn over the cloth they are wearing to avoid the irritation of the skin from the binder material. And I normally advise binder to be worn for about 8 to 12 weeks. Because 6 to 8 weeks is the time during which the rectus sheath, the vicarial stitches which we take on the rectus sheath, it heals completely. I want during the healing of that binder, because of that during the healing of that rectus sheath, because of the external stabilizer forces, the rectus sheath should not have any movement. With increased intra-abdominal pressure of cough, vomiting, constipation, there should be an external stabilizer force which helps in an optimal healing of rectus sheath, which will not only prevent the burst abdomen in an acute phase, it will also prevent the formation of hernia later on in future. And like I said, in my short term, surgical site infection and seroma formation, pain and mobility would definitely help. Recent American and European guidelines, they have said, as early as 2022, they have said that no recommendations for or against, I am repeating, for or against the use of post-operative binders because there is a lack of data. But this binder improves pain, it improves mobility, it enhances recovery, and this enhanced recovery decreases the hospital stay of the patient. And this decreased hospital stay ultimately leads to the early return of the work to the patient and thereby decreasing the cost of hospitalization and better earning potential. So the use of binder is a cheap, cost-effective, non-invasive way of not only enhancing the recovery after surgery, ERAS, but also improving the long-term complications of the patient. So I personally believe that abdominal binder should be used in almost all kinds of abdominal surgery. In my branch, hysterectomy, cesarean section, maybe exploratory laparotomy, and it works wonders. Please like the video, please share the video, and please subscribe to our channel. Namaskar, bye-bye.